Dr. Malvehi. We're at Miami Beach Vein. I've just done a small saphenous vein ablation, and now we're going to do foam ablation or chemical ablation using foam sclerotherapy on a varicose vein and a series of spider veins that were connected here. So I'm going to get you to zoom in over here. This is where we perform the small saphenous vein endovenous ablation. You can see that skin looks great. We just went in through a little pinhole there, and we closed all the way through there, which is where the reflux was. And now this is a branch that was coming off there, so we're going to get this branch here, and ideally all of this is going to close from what we're going to do. So I'm going to prepare the foam. I have in this syringe here about 1.5 cc or so of polydocanol. It's actually brand name Sclerotherapy. It's the only medication that we use for ablation, and this is 0.5% polydocanol. So I'm going to run it through these two syringes through here. The stopcock is pointed off towards the needle. And then combining with air, what's going to happen is it's going to create a foam. So you see that clear liquid plus the air that was in there has already made sort of the shaving cream consistency type medication. And that does a couple things. It's going to increase the relative concentration or the potency of the medication. And it's also going to give the medication some volume, so it can effectively block out the inside of the vein, causing some irreversible damage to what's called the endothelium, of the lining of the vein, which is what we want, so that it will shut down and essentially close off. So what I've done is primed a small scalping needle, and this is a needle that they use to draw blood from little babies, so it's about as small as you can go. I'm going to make sure we have a nice foam going there. Okay. And then I'm going to come over here, over to the vein, and we're going to make sure that we get this guy right here. Little pinch, one of those tres. Okay. So we're in there, and we have a nice patient, and you can see a nice flash of blood, so we know we're in the vein. And now we're going to go ahead and just slowly inject the medication. You can see that vein sort of disappearing right before our eyes. And we're just going to sit here and let that medication go all the way in. And you can see that vein disappearing, and more importantly, all of those little branch spider veins that are attached to it, those are going to disappear too. We just need to give them some time. So you can see them starting to disappear there as some of the foam goes through. Okay, so instead of doing a bunch of tiny little injections, what we like to do is get to the root of the problem and make sure that we address the root of the problem. So we address the true root by addressing the small saphenous vein reflux that she had, and we did that with an endovenous ablation. And then we're going to follow that up and make sure that we do all the necessary touch-up, and you can see the vein is gone. So I'm Dr. Malvehi. This has been me taking apart a varicose vein. Now the vein's gone. She'll wear compression for a day or two, and that's it. Bye-bye.